Good afternoon, everyone. So today I'm going to talk about the monsoon wellness. As we all know, the monsoon, once it comes, it beats the heat, but it also gets some seasonal diseases. And today we are going to talk on those monsoon-related diseases, how to prevent that, what are the myths, and what are the practical tips to prevent those diseases, or what are the early symptoms and how you can deal with, and what are the symptoms where you should immediately meet a doctor. So when we talk about the monsoon disease, anyway, I was discussing about the myths which we follow with the monsoon. So basically, people think that when we get wet in the rain, it causes fever. But it's not about the water, but it is about the viruses and bacterial overload which happens during the rainy season. It causes the diseases. People think that the mosquitoes bite only in the night, but most of the vector-borne diseases like the AIDS mosquito, which spreads the dengue, and malaria, which usually active at morning and evening sessions. Um, Boiled water, people think that it is safe. Boiled water is safe when it is boiled at the for 20 minutes at 100 degrees Celsius, and it even if when you store it, it should be stored in the as a clean vessel. Uh, Strong immunity. People think that if my immune system is strong, we cannot catch the monsoon diseases, but vector-borne diseases can happen to anyone, like dengue, malaria, the mosquito-borne diseases can happen to anyone, and that is nothing to do with the immune system. So, what are the infections and how we catch up with the infections? So, there are certain pathways which we get the infections, like the airborne transmission, like routine cough and cold, influenza, flu, and other respiratory tract infections like pneumonia can spread through the airborne transmission. Food and contaminated water can spread the waterborne diseases like typhoid, cholera, jaundice, gastroenteritis with contaminated food and water. Vector-borne diseases usually happens due to stagnation of water, where the vectors will breed. These are the breeding grounds for mosquitoes, and those diseases like dengue, malaria, chikungunya will be spread through the stagnant water, where the breeding sites for the mosquitoes. Most of the time, this waterlogging areas, which increases the and high humidity, stagnant water, um increases the seasonal illnesses. Uh, the high waterlogging areas, especially rice field waterlogging areas, flooded areas, can have the outbreaks of leptospirosis. This is also a viral disease which spread through the rodents, and rodents usually will be more in the flood areas. Many fungal infections can be get extracted during the high humidity. And as I said, through the contaminated water and stagnant water, we can have the vector-borne diseases. So, what are the common disease which we see, and what are the symptoms for those diseases? So, the most common vector-borne disease which we see is dengue and malaria. Any patients, usually dengue will have a two phases. In phase one of dengue, patient can get high degree temperature, he can get chills, severe headache, body ache, or he can face a pain behind his eyes. There can be a skin rash, joint pain, muscle pain, and severe dehydration happens. So usually in phase one of dengue, which lasts for almost day 1 to day 4 to 5, patient can have these symptoms, but once after day 5 of fever, usually patient starts the fever starts declining, but the platelet count will start dropping. So any fever which last more than 3 days, causing severe headache, joint pain, muscle pain, should be evaluated for dengue. Secondly, the malaria, which causes usually a high grade fever and cyclical chills. Cyclical chills means you can get a high grade temperature with fever with a certain interval, like either 8th hourly fever or 12th hourly fever, or once in a day, like once in a 24 hours, you can have a high grade fever. It can be associated with sweating, nausea, vomiting, severe tiredness, and usually symptoms appears almost 10 to 15 days after the mosquito bite. The other one which we are come across as a vector-borne disease is a leptospirosis. This disease is also similar like a dengue, which causes a severe muscle ache, eye redness, fever, high-grade fever, and usually this usually spreads through the when the skin get exposed with the flood water. And this is disease causes so much dehydration that it can progress into organ failure, like somebody can get the liver failure, kidney failure, if it is not treated early. The other most commonly which we come across is a typhoid and acute gastroenteritis. In typhoid and acute gastroenteritis, you can have a severe fever. This fever is very typical fever. The fever in the typhoid doesn't come down. Even if you take paracetamol, you do tepid sponging, fever keeps going high and high, and it is like a step ladder fever, which we will call it, like the fever keeps going high and high. If the persistent high grade temperature more than 3 days associated with abdominal cramps, sometimes loose motion, sometimes constipation, vomiting, loss of appetite, should be evaluated for the typhoid or acute gastroenteritis. My slides are moving, Raksha. Yeah. So, uh, when we should contact a hospital, this is the most important thing I feel that everyone should know. So any fever which lasts more than 2 days, associated with bleeding gums, nose, skin rash with fever, should immediately go to doctor or a nearest hospital. Any extreme fatigue, confusion, inability to stand, irritability should be considered as early as possible. Vomiting, blood, or dark colored vomitus or dark color urine should be immediately addressed in a hospital setup. Difficulty breathing, chest pain could be a sign of pneumonia and should be addressed as early as possible, especially in cases of young kids or elderly people or people who has a diabetes or associated comorbid condition should be immediately go to the hospital. Uh, Especially when the fever is high, if you have more than 2 days, up to 2 days taking paracetamol or routine household remedies are safe, but don't self medicate with antibiotics or painkillers like ibuprofen, because these painkillers are not safe. If it is dengue, it can further reduce the platelet count or it can worsen the bleeding issues. Always consult a doctor first before taking any painkillers or antibiotics. Antibiotics usually won't work in case of viral illnesses or vector-borne diseases, so they are only useful in case of bacterial infections. In fact, in viral fever, when the antibiotics are not required and you take antibiotics, it causes more gastritis and sometimes it causes vomiting, more vomiting, and dehydration. So, avoid taking self medications and consult a doctor as early as possible. So, how to prevent these seasonal diseases? I think this is nothing new which I am telling, but it is very important to emphasize again and again so that we can prevent even at least preventable seasonal diseases. So, always drink safe water. use boiled water or UV filtered water or sealed water. Never drink water from the tap or open containers during monsoon season. Eliminate standing water. Any stagnated water can be a source for breeding grounds for mosquitoes. Hence, empty coolers, plant pots, buckets, tires weekly, and even bottle caps of water can breed almost 200 plus mosquito larvae. Always use mosquito repellents or mosquito mesh to prevent the vector-borne diseases. Wash your hands frequently with soap and water for at least 20 seconds before meals, after outdoor exposure, and after using restroom. Always eat fresh and fresh cook and home cooked food. Avoid eating raw salads, cut fruits from the street, roadside snacks. Always carry your tiffin box during the monsoon season. So, one more prevention which is very important, I feel, in monsoon season are vaccinations. So, there are certain vaccines which we should be considering to prevent certain illnesses like flu, influenza. So, you would have heard of this bird flu, swine flu, and many times the patients can be so sick that they need ICU admissions or long hospitalization due to these diseases. So it is very important to get yourself vaccinated for influenza or pneumococcal vaccines. Influenza protects against flu, and pneumococcal vaccines protects you against pneumonia or any serious respiratory illnesses. Especially young generation or kids should be vaccinated for influenza, and all the elderly people above 60 should get influenza along with pneumococcal vaccine. Any heart patient, kidney patients, any patients who has a bronchial asthma or having a COPD should vaccinate for influenza and pneumococcal vaccine. Certain endemic areas should get vaccinated for typhoid and typhoid, cholera, and hepatitis A vaccines. Leptospirosis vaccine is not yet available, and it is only prevention which can prevent the leptospira, especially in the flooded areas and the people who works in the farms and the rice fields. So people who work as a field team, or those who are a long commuter, or you need to travel in a stagnated water. If you look at the image, you should wear the long shoes, at least a knee level shoes, which can prevent you from any infection like a leptospira, because these viruses enter through the cut skin or any wound on the feet, and when you come in contact with the contaminated water, you can get those diseases, and those diseases can be quite fatal if not treated on time. So always carry extra waterproof, means extra pair of cloth with you, or keep one pair of cloth in your office setup, so that if you even drench in the water or get wet in the rains, at least you can change. Because nowadays sitting in the AC with wet clothes again can cause you even the routine cough and cold, or serious illness like a pneumonia also. Um, Carry waterproof footwears and extra jacket always with you, and carry your own lunch box or food whenever you travel outside. So, what are the home care tips you should follow if you are not well, or somebody, the family member, is suffering for fever? The most important thing I feel is the hydration. Any disease, anything, whether it's a gastroenteritis, whether it's an influenza, whether it's a cough, cold, anything, the most important thing is your hydration. Many times what happens, people will have a sore throat and they have a difficulty swallowing. So they don't drink enough water and they come to us with a severe dehydration and complications related with even simple cough and cold. So just keeping yourself hydrated can eliminate hospitalization or serious issues associated with a simple fever or a common cold. Rest is the best treatment always. Usually, body's repair and regeneration work happens when you sleep well. So, the resting, taking a rest during your illness is the most important thing. The more you sleep, you will recover fast. So, staying yourself hydrated and taking rest is the best thing which you can do. Either you can use some oral rehydration solution like ORS, or you can use just homemade salt water, salt sugar water if you are not a diabetic, or you can take a tender coconut water to keep yourself hydrated. The best medicine to treat with any fever, body ache is a paracetamol. So usually we say to avoid any painkillers like ibuprofen, aspirin, because we never know which fever is a dengue fever, which fever is malaria, which fever is gastroenteritis. So paracetamol is safe in all conditions. And even somebody has any heart issue, kidney issue, elderly patient, young kids, even for them paracetamol is a safe when it is given in the right dosages. Always keep your wounds clean and cover. Suppose if you have any skin cuts, abrasions, minor skin infections, always wash that with antiseptic soap and water and cover them with a clean and dry dressing to prevent secondary bacterial infections. Many times, wet cloths or wet shoes, socks can cause more fungal infections. So that also very important. Fungus grows only when the area is wet. In dry area, fungus will never grow. So many times, fungal infections can be a routine problem for some diabetic patients during the monsoon season. You especially in the body folds like a groin, armpit. So it's very important to wear clean and dry clothes. Maintain hygiene and isolate yourself. See, we have gone through a COVID pandemic, and everybody knows that the isolation helps in airborne diseases. So, even the same rule is applicable for all other respiratory illnesses also. So, if you wash your hands regularly and isolate yourself when you have any cough, cold, fever, that itself prevents the other family members getting infected with the similar disease. And most important thing, monitor and document your symptoms. Like you have to keep a diary of your temperature. So there are many clues which your doctor will get just with your history, like how frequently you are getting fever, what is the grade of temperature which you are having, and how it is evolving, whether your fever is going up, whether it is reducing, whether you have at the peak of your infection or you are in the recovery phase. It is very important to document your symptoms and monitor yourself. So, the disease specific points, if I want to discuss, I have already told that any fever, especially dengue fever, paracetamol is the most important thing. Hydration is again the most important thing. So, never use any painkillers, any antibiotics. If somebody is, suppose your family member is suffering from dengue, even you can, and you are getting fever, even the same mosquito would have uh, bitten to you, it could be possibly it could be a dengue. So be careful not to take any painkillers or any antibiotics in such a situation. Even in malaria, um if you are experiencing high fever with chills, severe sweating, any abdominal discomfort, you need to get a blood test immediately. Keep yourself hydrated. The prompt diagnosis is crucial because malaria we cannot treat at home. Typhoid fever, again, persistent high fever will make you dehydrated. It can cause you severe fever, abdominal pain. Sometimes the typhoid can cause the gastric ulcers and severe abdominal pain can worsen. So, testing for typhoid fever by doing a routine blood test also, like a fever workup test, is immediately, if you do it, is really helpful. And because typhoid needs antibiotics to be started. And always focus on soft gentle food when you are suffering for any fever. Leptospirosis usually happens when there is a flood water, or there is a farmers who works in the rice fields. So it can cause a sudden high grade fevers, and muscle aches will be extreme. It can cause sometimes a jaundice, the yellowish discoloration of eyes or skin. When you notice any yellowish discoloration, immediately you need to consult a doctor, because it might require to evaluate whether it's a leptospira, whether it is a jaundice related with the hepatitis. So avoid self-medicated medications and immediately go to the nearest hospital. So what are the the moral of this whole thing is a prevention. So we need to eliminating a stagnant water will eliminate the vectors and prevent many vector borne diseases. Drink safe water for the uh, waterborne diseases. Cover up by using full sleeves, mosquito repellent, waterproof gears, and even waterproof shoes. Act fast. If the fever is more than 2 days, don't wait. Visit a doctor immediately and vaccinate yourself for the preventable diseases like influenza, typhoid, hepatitis, pneumococcal. So your health is more important as it. Vaccinations always prevent, and you need to act fast. So, uh, thank you everyone.